pathology, and when we do the examination of the patient, we see some growth, and in advanced stages we see a cauliflower like growth, that is, it is a hypertrophy of the cells, and there is bleed on touch. When we are examining the patient, we see that the patient starts bleeding profusely in the later stages. So this is the pathology that we see, and primarily it is seen in the postmenopausal age group, but these days we see it occurring in the earlier ages also. So how does it start? What is the protocol that we follow? Earlier history taking, many times we see the family history or history of multiple partners or exposures we find in such patients, and then after that we do the physical examination, visual inspection, and Pap smear is the primary testing kit that we follow. Pap smear, HPV testing, and then we go for the cervical biopsies. Colposcopy is being used these days, which magnifies the cervix, and it helps us to have a better vision of the lesion, and later on we can go for the biopsy examination. So Pap smear is very important. When a female patient of childbearing age group comes to our OPD, it is mandatory for us to do a Pap smear, because it somewhat gives us an idea about the cervical health of the patient. So it is of utmost importance. And then, as sir has said, that vaccination is also very important as far as the preventive aspect is concerned. So it is to be given, starts from 0 to 9, but the most eligible age is considered to be 11 to 9 years, and it can be given in 2 shots or 3 shots. Prevention of cancer, there are several aspects which aggravate cancer risks, that is multiple sexual partners. That is why we see that in places where, or in women who are exposed to multiple sexual partners, HPV is more common. Smoking, oral contraceptives, and sexually transmitted diseases. So unlocking the key to cervical cancer prevention. So firstly, preventive measures, how it can be prevented. We will be discussing the Ayurvedic aspect also, but according to WHO guidelines, firstly, practicing a safe sex is very important. Maintaining a good personal hygiene. We see that in rural areas, these conditions are not being followed maybe, and that is the reason why we see a higher incidence of cervical cancer in rural areas. Although multiple sexual partners, alcohol and smoking attribute to higher the incidence in urban areas also. So maintaining good personal hygiene is very important. Having fewer sexual partners and quitting smoking. Mechanism of action of Ayurvedic management. Now coming to the Ayurvedic part, जैसा कि हम जानते हैं कि आयुर्वेद में most of the conditions are covered up under the topic of yoni व्यापक. So yoni